Have you ever felt tired for days without knowing why? Woke up with a bit of swelling around your eyes? Or felt a dull ache in your lower back that just wouldn't go away? Most people think, it's just age. I'm getting older, that's normal. But sometimes, those subtle signs are your kidneys trying to get your attention. The kidneys are quiet workers. They don't scream for help. They don't make you dizzy or feverish right away. But every single day, they carry out massive responsibilities behind the scenes. Filtering waste, regulating blood pressure, balancing fluids and minerals, producing essential hormones, and more. The scary truth? Your kidneys can lose 50% of their function without making a sound. I once knew a retired teacher. He lived healthily, didn't drink, ate well. One day, during a routine checkup, doctors discovered he had stage 2 kidney disease. No pain, no major symptoms, just mild fatigue he thought was part of aging. That story isn't rare. That's why in this video we'll explore how essential your kidneys are, especially after age 50. The silent signs that your kidneys may be struggling. Which medications and everyday habits quietly damage kidney function. And most importantly, how you can protect your kidneys to live stronger, longer, and more independently in your later years. Don't look away. A few minutes of knowledge today could save you years of dialysis and hospital visits tomorrow. Your kidneys may be silent, but if you choose to listen, they can give you a lifetime of strength in return. If you ask the average person what kidneys do, most would say, they make urine. That's not wrong, but it's only a small part of a much larger story. Your kidneys aren't just filters. They are biological control centers that manage a wide range of functions crucial to your health, especially as you age. Think of your body as a small city. Your kidneys act like city managers, handling waste management, water supply, energy regulation, emergency response, and even traffic control, all at once. Here are 7 essential roles your kidneys perform every day, without rest, even while you sleep. 1. Cleansing your blood, removing toxic waste. Your kidneys filter about 150 to 180 litres of blood daily, eliminating waste products from food, medications, and your own metabolism. If kidney function declines, toxins like urea and creatinine build up in the blood, leading to nausea, fatigue, itching, and even heart or brain complications. 2. Balancing water and electrolytes. Your kidneys manage your body's fluid levels and maintain electrolyte balance: sodium, potassium, calcium, magnesium. Critical for heart rhythm, nerve signaling, and muscle function. If these levels shift, it can lead to seizures, muscle cramps, irregular heartbeat, or worse. 3. Regulating blood pressure. Few people realize that the kidneys produce renin, an enzyme that helps control blood pressure. When kidney function weakens, renin levels become abnormal, contributing to chronic hypertension. And high blood pressure, in turn, damages kidney blood vessels, creating a dangerous cycle. 4. Producing hormones that create red blood cells, kidneys release erythropoietin, a hormone that tells your bone marrow to make red blood cells. When this process slows down, you develop chronic anemia, feeling tired, lightheaded, and short of breath, even with simple tasks. 5. Helping keep your bones strong. Your kidneys activate vitamin D, allowing your body to absorb calcium properly. When kidney function declines, calcium absorption drops, leading to weaker, brittle bones, even if you're eating well. 6. Maintaining acid-base balance. Every day your body produces acid from food and energy use. Your kidneys help neutralize and eliminate excess acid to maintain a stable blood pH level around 7.4. If acid builds up, you may experience fatigue, loss of appetite, confusion, and in severe cases, coma or death. 7. Working overtime, even when one kidney fails. Here's something incredible. If one kidney is damaged, the other can double its workload to keep you alive. But over time, even the healthy kidney can burn out if the damage isn't caught early. Bottom line? Your kidneys are doing far more than you think. And just because you feel fine today doesn't mean they're not silently struggling behind the scenes. Here's the hard truth. Your kidneys can lose more than 50% of their function before any symptoms appear. They are quiet survivors, working day and night, filtering your blood, removing waste, balancing fluids, until one day they can't keep up. But your body often whispers early warnings, subtle changes that can go unnoticed if you're not paying attention. Let's look at 9 early signs that your kidneys might be in trouble. 1. Constant fatigue, even after a full night's rest. Damaged kidneys produce less erythropoietin, a hormone that helps create red blood cells. Fewer red blood cells mean less oxygen delivery. You feel tired, weak, foggy even after doing very little. 2. Trouble sleeping or waking up during the night. When toxins build up in your bloodstream, they disrupt your nervous system and melatonin balance, causing restless sleep, vivid dreams, or waking up multiple times per night. 3. Itchy, dry skin, especially at night. Poor kidney function leads to mineral imbalances and waste buildup, which can make your skin dry and intensely itchy, even if you use lotion or don't see a rash. 4. Frequent urination at night, or unusually low urine output. Changes in your urine pattern, whether you're going more often, less often, or waking up to pee multiple times, could mean your kidney filters are damaged. 5. Swelling around the eyes, ankles, or feet. When kidneys don't remove excess salt and water effectively, fluid builds up, starting with subtle puffiness in the ankles, feet, or under the eyes in the morning. Foamy or bubbly urine. This is a key sign that protein is leaking into your urine. A red flag that your kidneys' filtering membranes are breaking down. Even if your urine looks normal in color, those persistent bubbles may signal early kidney damage. 7. Loss of appetite, nausea, or metallic taste in your mouth. As toxins accumulate in the bloodstream, they can affect your digestive system and taste buds, making food unappealing or causing a strange metallic flavor. 8. Bad breath with an ammonia-like smell. Kidneys that aren't working properly allow nitrogen waste to linger in your system, which can make your breath smell like urine, even with good dental hygiene. 9. Chills or feeling cold more often than others. Low red blood cell counts and disrupted metabolism from kidney disease can make you feel cold, even in warm environments. A gentle reminder. These signs often show up one by one and may seem unrelated at first. But if you've been noticing changes that persist for 2 weeks or longer, don't brush them off. Ask your doctor for a simple blood and urine test to check your kidney function. The sooner you catch a problem, the easier it is to protect your future. Lower back pain is one of the most common complaints among people over 50. Maybe you lifted something heavy. Maybe you slept wrong. Maybe you've been sitting too long. Most people assume it's joint or spine related. But here's what many overlook. Sometimes that dull, lingering ache in your back isn't from your muscles. It's your kidneys. Knowing the difference could save your kidney function. So how do you tell them apart? Let's break it down. 1. Pain location. Kidney pain is usually felt deeper, on one or both sides of your lower back, just below the rib cage. Back or spine pain tends to center in the middle and may radiate down the legs. 2. Pain and movement. Muscle or joint pain gets worse when you bend, twist, or move around. Kidney pain usually stays constant, no matter how you sit or lie down. 3. Accompanying symptoms. Kidney-related pain may come with fever or chills, changes in urination, like burning, cloudy urine or blood, nausea or fatigue. 4. Tap test, used by doctors. Doctors often gently tap your back near your lower ribs. If you feel sharp, localized pain, that could indicate a kidney infection or inflammation. A real-world example. A 62-year-old woman came in for persistent back pain. She'd been treating it as joint pain, using creams, massage, even arthritis meds, but nothing helped. An urine test showed protein and white blood cells. An ultrasound found a 4mm kidney stone, causing mild swelling in one kidney. She had no fever, no burning, just fatigue and back discomfort. If she had ignored it longer, it could have led to kidney infection, severe pain, or long-term damage. Important reminder: if you're over 50, and especially if you have high blood pressure, diabetes, or a history of kidney issues, don't automatically assume your back pain is from old age. Get a urine test and kidney function check. It's quick, easy, and could give you peace of mind, or catch a serious issue early. Sometimes your kidneys don't scream for help. They whisper through subtle pain. And it's up to you to listen before it's too late. Have you ever taken a painkiller and felt better within minutes? Or grabbed a supplement, a sleep aid, or cold medicine, thinking it's harmless? The truth is, many medications we use every day, especially after age 50, can quietly strain and damage the kidneys. As we age, our kidney function naturally declines. When we add daily medications on top of that, even over-the-counter ones, we may be slowly pushing our kidneys beyond their limits without realizing it. Let's take a closer look at some of the most common medications that can harm your kidneys if used improperly or long-term. 1. Non-steroidal anti-inflammatory drugs, NSAIDs. Examples: ibuprofen, naproxen, diclofenac, celecoxib. Used for joint pain, backaches, headaches, arthritis, fever. NSAIDs can reduce blood flow to the kidneys, causing oxygen deprivation, lead to acute or chronic inflammation in kidney tissues, increase blood pressure and fluid retention, worsening kidney stress. People over 60, especially those with heart or blood pressure issues, should use NSAIDs only under medical guidance and for short durations. 2. Antibiotics, especially aminoglycosides, vancomycin, and some cephalosporins. Overusing antibiotics, even for minor colds, can be dangerous. Certain antibiotics can be toxic to kidney tubules, causing inflammation or even tissue death in extreme cases. Risk increases when antibiotics are combined with NSAIDs or diuretics. 3. Diuretics, water pills. Examples: furosemide, hydrochlorothiazide. Used for high blood pressure, congestive heart failure, swelling in legs or ankles. But in high doses or without monitoring, diuretics can lower blood volume too much, reducing kidney perfusion. Cause electrolyte imbalances, leading to cramps or irregular heartbeat. Trigger metabolic acidosis or acute kidney injury. 4. Immunosuppressants and chemotherapy drugs. Used to treat autoimmune diseases and cancer. Some can cause interstitial nephritis, glomerular damage, or chronic kidney scarring, especially with long-term use or improper dosing. 5. Herbal supplements marketed as kidney boosters. Many older adults take natural supplements labeled as kidney detox, energy boosters, men's vitality formulas. But some of these contain heavy metals like lead or mercury, steroids or hidden pharmaceutical ingredients, unregulated plant extracts with unknown side effects. Just because something is herbal doesn't mean it's safe for your kidneys. So, what should you do? Always tell your doctor or pharmacist about all medications and supplements you're taking, even over-the-counter or natural ones. Don't self-medicate for pain without understanding the root cause. Get your kidney function tested, blood and urine tests, every 6 months if you're on long-term medications. One small pill may ease your pain today, but it could silently set your kidneys on the path to long-term damage. Make every medication choice a mindful one, because your kidneys will feel the consequences even if you don't. When we talk about kidney health, most people think of medication, blood tests, or dialysis. But your kidneys respond directly to what you eat, whether it's a simple breakfast or a salty dinner. The good news is, you can lighten the load on your kidneys and even slow down kidney decline just by choosing the right foods. Let's explore the foods that support healthy kidneys and those that quietly cause harm. Kidney-friendly foods that help your kidneys breathe easier every day. 1. Bell peppers. Rich in vitamin C, A and antioxidants. Low in potassium, safe for people with kidney issues. Helps reduce inflammation and protect kidney cells. 2. Green cabbage. High in fiber, vitamin K, C, B6. Very low in sodium, potassium and phosphorus. Supports digestion and detox naturally. 3. Apples. Loaded with soluble fiber, reduces cholesterol and inflammation. Easy to digest and gentle on the kidneys. A great alternative to salty or sugary snacks. 4. Garlic in moderation. Natural anti-inflammatory and antibacterial. Adds flavor without adding salt. Supports blood circulation and kidney microvessels. 5. Egg whites. High quality protein with low phosphorus. Ideal for people who need to limit protein but still need nutrition. Avoid excess yolks if you have cholesterol concerns. 6. Olive oil. Healthy monounsaturated fats. No phosphorus or sodium. Better choice than vegetable oils or butter. Foods to limit or avoid to protect your kidneys. Processed and packaged foods. Canned, frozen fast food. Often loaded with sodium, preservatives, and phosphate additives. Increase the filtering burden on the kidneys. Raise blood pressure and promote fluid retention. Red meat, beef, lamb, bacon, sausages. High in animal protein and purines. Produces more waste, urea, uric acid, creatinine, for the kidneys to process, linked to inflammation and kidney overload. Soda and energy drinks. Contain phosphoric acid and refined sugars. Increase risk of kidney stones and insulin resistance. Can lead to weight gain, diabetes and chronic kidney disease. Salt, sodium. causes fluid retention, high blood pressure, and kidney strain. Found in sauces, dressings, snacks, canned soups, even bread. Smart habits to support kidney health through food. Eat less salt, check labels, and cook with herbs instead. Drink enough water throughout the day, not too much, not too little. Shift from red meat to plant-based proteins like tofu, walnuts, oats. Eat smaller meals more frequently. Avoid heavy overloads. Final thought. Your kidneys don't remember what you ate yesterday, but they will feel the effects of what you eat today. Every meal is a chance to protect your kidneys or push them closer to trouble. One of the most common things I hear from older adults is, "I feel fine, I pee normally, I'm probably okay." But here's the truth. Chronic kidney disease, CKD, is a silent condition that can progress for years without clear symptoms. It doesn't choose its victims. But there are certain groups of people who are at much higher risk. If you fall into any of these categories, it's time to get proactive, even if you feel healthy. 1. People with long-standing high blood pressure. High blood pressure damages tiny blood vessels in the kidneys, especially the glomeruli. In the US, nearly 1/3 of kidney disease cases are linked to hypertension. Worse, kidney damage can make high blood pressure harder to control, creating a dangerous cycle. 2. People with diabetes, especially type 2. Diabetes is the #1 cause of chronic kidney disease in America. High blood sugar gradually scars the kidney's filtering units, leading to protein leaks, albuminuria. Many people don't realize their kidneys are failing until they've lost half or more of their function. 3. People with a family history of kidney disease. If your parents or siblings have had kidney problems, dialysis, or transplants, your risk is 2 to 3 times higher. Some kidney conditions, like nephrotic syndrome or polycystic kidney disease, have genetic links. 4. Adults over age 60. Kidney function naturally declines with age, roughly 1% per year after 50. Even if you're healthy, this slow decline can accelerate with poor habits or other conditions. Most seniors lose significant kidney function without realizing it. People with a history of kidney stones, UTIs, or infections. Repeated kidney infections or stone blockages can damage kidney tissue permanently. Left untreated, they lead to scarring, swelling, and long-term loss of function. 6. People who are overweight, inactive, or smoke. Salt and sugar-heavy diets increase blood pressure and insulin resistance. Smoking damages kidney blood vessels, cutting off circulation. Lack of movement reduces blood flow to the kidneys. Over time, this adds up. 7. People taking multiple medications long-term. If you're using NSAIDs, antibiotics, diuretics, chemotherapy, or supplements daily, your kidneys are constantly filtering them. Without regular testing, you may not notice damage until it's severe. A final thought. Silence doesn't mean safety. Sometimes silence is the beginning of disease. Don't wait until there's pain, blood in your urine, or severe swelling. If you're in a high-risk group, get tested now. A simple blood and urine test every 6 to 12 months could protect you from years of dialysis, fatigue, or hospitalization. Here's something many people don't realize. Most people only discover they have kidney disease when it's already advanced. By the time you feel swelling, fatigue, or changes in urination, you may have already lost 50% or more of your kidney function. But there's good news. Kidney damage is detectable long before symptoms show up, with just a few simple, painless, affordable tests. If you're over 50 or have any risk factors, these tests could protect you from years of dialysis, hospital stays, or worse. 1. Blood test. Creatinine and eGFR. Creatinine is a waste product filtered by the kidneys. If it builds up in your blood, your kidneys may not be working well. eGFR, estimated glomerular filtration rate, shows how well your kidneys are filtering. An eGFR below 60 may indicate chronic kidney disease, even if you feel fine. Doctors recommend tracking eGFR over time, not just a one-time result. 2. Urine test. Urinalysis, 10 parameters. This test checks protein in the urine, a key sign of kidney damage, red and white blood cells, possible infection or inflammation, glucose, pH, ketones, and more to assess your overall health. If you consistently have protein in your urine, your kidney filters may be breaking down. 3. ACR, albumin to creatinine ratio. This test is more sensitive than a standard urine test. It can detect tiny amounts of albumin in your urine even before other signs appear. ACR is especially important for people with diabetes or high blood pressure, adults over 60, anyone with a family history of kidney disease. If ACR stays elevated for more than 3 months, you may already have kidney disease. 4. Kidney ultrasound. A safe, painless scan that can detect kidney size. Smaller kidneys may suggest chronic damage. Swelling or fluid retention, suggesting blockage or stones. Cysts, tumours, or structural issues. Ultrasound helps spot mechanical causes of kidney problems that blood tests might miss. 5. Blood pressure, blood sugar, and cholesterol checks. You can't talk about kidney health without checking blood pressure. High BP silently damages kidney blood vessels. Blood sugar. Uncontrolled diabetes destroys filtering units. Cholesterol affects circulation and kidney oxygen supply. Kidney health is deeply connected to your metabolism and cardiovascular system. Expert advice. Your kidneys won't cry out in pain, but a lab test can speak for them. If you're over 50, get these tests at least once a year if you're generally healthy. Get tested twice a year if you have diabetes, hypertension, or take long-term medications. Just one simple test today can save you from months of fatigue, costly hospital visits, and the emotional toll of advanced kidney disease later. Don't wait. Check now and protect your future. You might be drinking enough water, eating okay, and seeing your doctor occasionally, but your kidneys could still be under stress. Why? Because some of the most common daily habits, things you don't even think twice about, can slowly, silently wear down your kidney function over time. Let's take a look at 7 habits that seem harmless but can actually lead to kidney damage if done long enough. 1. Holding in urine for too long. Waiting too long to urinate can increase pressure in your bladder and kidneys. This can lead to urinary tract infections, UTIs, or even hydronephrosis, swollen kidneys. Seniors often delay going to the bathroom, especially at night. This is risky. Tip: make bathroom trips part of your routine. Don't wait until it's urgent. 2. Not drinking enough water. Dehydration thickens your blood and makes the kidneys work harder. In the long term, this can lead to kidney stones and reduced function. Many older adults drink less to avoid nighttime urination, a dangerous trade-off. Tip: sip water throughout the day. Even small amounts help. 3. Overusing painkillers, especially NSAIDs. Medications like ibuprofen, naproxen, aspirin can damage kidney blood vessels. Long-term use increases risk of chronic kidney disease. Many people use these daily for joint pain without realizing the risk. Tip: use pain meds sparingly and always under medical guidance. 4. Eating too much salt. High sodium intake causes fluid retention and high blood pressure. This increases pressure inside the kidneys, damaging their filters. Even healthy seniors can develop kidney strain from salty soups, snacks, or takeout. Tip: season with herbs, garlic, or lemon. Not salt. 5. Eating too much protein, especially red meat. Excess protein creates more nitrogen waste, making kidneys work overtime. Red meat and protein shakes can worsen kidney function if already impaired. Seniors often add protein for strength but overdo it. Tip: mix in plant proteins, lentils, tofu, nuts, quinoa. 6. Not controlling blood pressure and blood sugar. These are the #1 causes of kidney disease in the US. Even if you feel fine, unmanaged levels quietly scar the kidneys. Checking once a year is not enough. Monitor regularly. Tip: get your BP and glucose checked every 3 to 6 months. 7. Ignoring urinary symptoms. Painful urination, blood in urine, foamy pee, or needing to go often. These aren't just aging, they can be early kidney or bladder issues. Many ignore them out of embarrassment or fear. Tip: speak up. Early detection saves lives. A final word: you don't need to overhaul your entire life, but you do need to notice the little things. Small choices every day, like what you eat, how you hydrate, how often you go, can either protect your kidneys or quietly chip away at them. And once they're gone, there's no going back. Your kidneys don't need you to be perfect. They don't demand a strict diet or punishing workouts. What they need is consistency. After age 60, your kidneys naturally work a little slower. But with the right habits, you can support their function for decades to come. Here's your daily blueprint for keeping your kidneys strong and supported, without stress or confusion. Morning habits. Start your day with a glass of warm water. Gently rehydrates your system and jumpstarts kidney filtration. Take your prescribed medications as directed. Never skip or double dose, especially blood pressure or diabetes meds. Eat a kidney-friendly breakfast. Include low-sodium protein, whole grains, and a fruit like apple or berries. Avoid salty sausage, cured meats, or processed cheese. Midday habits. Stay lightly active. A 20 to 30-minute walk helps blood flow through the kidneys. Movement reduces pressure on your heart and vessels. Drink water in small amounts regularly. Don't chug all at once. Aim for 6 to 8 cups per day, unless your doctor says otherwise. Watch your salt intake at lunch. Soups, sauces, and restaurant food often have hidden sodium. Look for low-sodium labels or make meals at home. Evening habits: avoid heavy protein meals at night. Large steaks or too many eggs can burden kidneys overnight. Limit alcohol and caffeine. Both dehydrate and make kidneys work harder. Don't ignore nighttime urination. If you go often, ask your doctor. It could signal early kidney or prostate issues. Before bed, elevate your feet for 15-20 minutes. Reduces swelling and improves circulation back to your kidneys. Reflect on your hydration and food choices. Small changes daily keep your kidneys happy long term. Extra tips for seniors: keep a health journal. Track urination, swelling, fatigue, or meds. Get blood and urine tests every 6-12 months. Early detection equals early protection. Ask your doctor about your eGFR and ACR, two numbers that tell the real story of your kidneys. Think of your kidneys like quiet partners. They do the hard work behind the scenes. All they ask is a little care in return. At 60 and beyond, protecting your kidneys means protecting your freedom, your energy, and your independence. Your kidneys are like silent workers, filtering your blood 24/7, cleaning out toxins and balancing fluids and minerals. But did you know some of the most common medications can quietly harm your kidneys if used for too long? Especially in people over 60 or those with diabetes, high blood pressure, or existing kidney conditions. This doesn't mean you should stop your meds, but it does mean you need to stay informed and monitor with your doctor. Here are 5 classes of drugs that deserve extra attention. 1. NSAIDs, non-steroidal anti-inflammatory drugs. Includes ibuprofen, Advil, Motrin, naproxen, Aleve, aspirin. These drugs reduce pain and inflammation, but can constrict blood flow to the kidneys. Long-term use increases risk of kidney damage, especially in seniors. Daily use, even in small doses, adds up. Tip: use only when necessary and avoid combining multiple NSAIDs. 2. Certain antibiotics includes gentamicin, vancomycin, ciprofloxacin. These are effective for infections but can be toxic to kidney cells, especially with high doses or prolonged use. Risk is higher in those with dehydration or pre-existing kidney conditions. Tip: stay well hydrated during antibiotic courses and monitor kidney function if used for more than a few days. 3. Diuretics, water pills. Includes furosemide, Lasix, hydrochlorothiazide, used to reduce swelling and blood pressure by removing fluid, can lead to dehydration, low potassium, and increased creatinine. Especially risky if you're not drinking enough water or already have CKD. Tip: monitor electrolytes and kidney numbers regularly if using long-term. 4. Proton pump inhibitors, PPIs. Includes omeprazole, Prilosec, esomeprazole, Nexium, used for acid reflux and ulcers. Linked to chronic kidney disease with long-term daily use. Many people take these for years without realizing potential harm. Tip: don't use PPIs longer than 8 to 12 weeks without doctor guidance. 5. Certain supplements and herbal remedies. Includes creatine, high-dose vitamin C. Some traditional herbs, natural. Doesn't always mean safe. Some herbs contain nephrotoxic compounds. Supplements may interact with medications or overload the kidneys. Tip: always tell your doctor about supplements you're taking, especially if you have health issues. Final thought: your kidneys don't just filter toxins. They filter every medication you swallow. The goal isn't to avoid medicine. The goal is to use it wisely. Monitor regularly and work with your doctor to protect your kidneys. One simple blood or urine test every few months can make all the difference. Kidney disease doesn't always come with a warning. In fact, millions of Americans are living with reduced kidney function right now, and they don't even know it. But here's the good news. Kidney disease is often preventable. If you know your risks early, let's walk through the most common risk factors so you can check if you or someone you love may need extra screening or lifestyle changes. 1. Adults over the age of 60. Natural aging causes a gradual decline in kidney function. Even if you feel fine, your filtration rate, eGFR, may drop. Regular testing is essential. Even once a year can catch early issues. Tip: ask your doctor for a kidney panel at your next checkup. 2. People with diabetes. Diabetes is the #1 cause of kidney failure in the US. High blood sugar damages the blood vessels in your kidneys. Up to 40% of people with diabetes develop some form of kidney disease. Tip: keep blood sugar under control and test your urine for protein yearly. 3. People with high blood pressure, hypertension. High blood pressure puts constant pressure on kidney filters. Over time, this leads to scarring and poor filtration. Many people with high BP don't feel symptoms, but kidneys suffer silently. Tip: target BP under 130/80 if you have any kidney risk. 4. Those with a family history of kidney disease. Genes matter. If a parent or sibling had kidney failure, your risk is higher. Conditions like polycystic kidney disease, PKD, are inherited. Even without symptoms, early screening is key. Tip: share your family history with your doctor. It affects your testing schedule. 5. People who are obese or lead a sedentary lifestyle. Obesity increases risk for diabetes, hypertension, and inflammation, all of which damage kidneys. Lack of exercise reduces circulation and raises metabolic stress. Tip: even 30 minutes of walking a day can make a difference. 6. Smokers and heavy drinkers. Smoking narrows blood vessels, including those in your kidneys. Excess alcohol dehydrates you and increases blood pressure. Both speed up kidney decline, especially after age 50. Tip: quitting isn't just for your lungs or liver, your kidneys benefit too. 7. People with autoimmune conditions or chronic infections. Conditions like lupus, hepatitis B or C, HIV can directly attack kidney tissues. Long-term inflammation overwhelms the filtering system. Tip: manage your underlying condition closely and test kidney function often. Final thought: you don't need to have symptoms to be at risk. You just need to know your body and take steps early. Knowing your risks isn't meant to scare you. It's meant to empower you so you can act before the damage begins. Because kidneys don't ask for attention until it's too late. When your kidneys work well, you don't think about them much. But when they begin to struggle, everything you eat matters. What you put on your plate can either lighten the load on your kidneys or slowly wear them down. That's why understanding kidney-friendly nutrition is one of the most powerful tools you have, especially after 60. Let's break it down. Top 6 foods to support kidney health. Cauliflower, low in potassium, high in fiber and antioxidants. A great substitute for mashed potatoes or rice. Blueberries packed with antioxidants and low in sodium and potassium. A perfect snack or breakfast topping. Red vitamin C, low in potassium. Garlic adds flavor without salt. Reduces inflammation and supports cardiovascular health. Safer for those with reduced kidney function. A healthy fat that's easy on the kidneys. Supports heart health which is closely tied to kidney health. Eat whole, fresh foods. Limit processed snacks and salty sauces. Foods to limit or avoid if you want to protect your kidneys. 1. Foods. Canned soups, processed meats, salty snacks. Fast food. Too much salt raises blood pressure and damages kidney filters. 2. Foods high in potassium. Bananas, oranges, potatoes, tomatoes. Only if you have kidney disease. Excess potassium can be dangerous if kidneys can't remove it properly. 3. Foods high in phosphorus. Dark sodas, processed cheese, packaged baked goods. Can cause calcium loss from bones and harm kidneys over time. 4. Too much animal protein. Red meat, organ meats, protein shakes. Increases acid and nitrogen waste, straining the kidneys. 5. Half-added sugar and sugary drinks. Linked to diabetes and obesity, 2 major causes of kidney disease. Soda and sweet teas are especially harmful. Tip: you don't need to cut everything. Just be mindful of portions and balance. Final word: food isn't just fuel. It's medicine, especially for organs that work quietly like your kidneys. Talk to a registered dietitian if you have concerns. They can create a kidney-friendly eating plan that's personalized, satisfying, and sustainable. Your kidneys will thank you, one bite at a time. Many people think of kidney problems as just something that affects urination, more bathroom trips, maybe some swelling. But the truth is far more serious. Your kidneys are connected to almost every major system in your body. When they weaken, the ripple effects go far beyond the bladder. Let's explore how kidney disease can quietly impact your entire health and why early protection matters so much. 1. It affects your heart. Damaged kidneys cause fluid and waste to build up in the blood. This increases blood pressure and makes the heart work harder. People with kidney disease are at much higher risk of heart attacks, strokes, and heart failure. Heart and kidney health go hand in hand. Caring for one protects the other. 2. It weakens your bones. Poor kidney function leads to calcium and phosphorus imbalances. This can trigger bone loss, fractures, and conditions like osteoporosis. It also increases the risk of painful bone and joint problems. Seniors with kidney disease should have their vitamin D and bone density checked. 3. It impairs your brain and mood. Toxins that the kidneys can't filter begin to build up in the blood. This can lead to confusion, poor concentration, depression, or memory issues. In advanced cases, a person may appear withdrawn, irritable, or even delirious. Tip: changes in thinking or mood may not be just aging, it could be kidneys. 4. It disrupts your blood and energy levels. Healthy kidneys make a hormone called erythropoietin that helps produce red blood cells. When kidneys decline, this process slows, leading to anemia and constant fatigue. Tip: feeling tired all the time. Don't just blame age, test your kidney function. 5. It weakens your immune system. The kidneys play a role in regulating immunity and inflammation. Chronic kidney disease makes you more vulnerable to infections, flu, and slower recovery. Tip: people with kidney issues should stay up to date with vaccines and wash hands often. Final insight: your kidneys don't just affect your urine. They affect your heart, bones, brain, and energy, quietly, until it's too late. The next time something feels off in your body, don't ignore it. Ask for a simple kidney test, because sometimes the root of the problem is deeper than you think. Your kidneys are remarkable. They work 24 hours a day without rest, filtering your blood, balancing minerals, and quietly supporting your health behind the scenes. But like any part of your body, they can wear down. And once kidney damage begins, it's often slow, silent, and irreversible. The good news? Simple, consistent habits can make a huge difference. You don't need to make drastic changes overnight. You just need to care and start small. Here are 10 simple habits that protect your kidneys for the long run. 1. Drink enough water, helps flush out toxins and prevents stones. Aim for 6 to 8 cups per day unless advised otherwise. 2. Limit salt and processed foods. Too much sodium raises blood pressure and damages kidney filters. 3. Manage blood sugar and blood pressure. These are the top 2 causes of kidney failure. Control them early. 4. Or sleep aids. The counter painkillers. NSAIDs can harm kidneys when used daily. 5. Stay active every day. Even gentle walking improves circulation and reduces risk factors. 6. Maintain a healthy weight. Reduces the burden on kidneys and lowers diabetes risk. 7. Unpredict enough sleep. Your body and kidneys recover during deep rest. 8. Ablag smoking and limit alcohol. Both harm blood vessels and increase kidney strain. 9. Remodeling kidney function regularly, especially if you're over 60 or have other risk factors. 10. Talk to your doctor about your medications. Some may need adjustment to protect your kidneys. Final message from the heart. Your health isn't just yours. It's a gift to the people who love you. By caring for your kidneys, you're not just protecting an organ. You're giving yourself the chance to live fully, love deeply, and age with grace. So let's not wait for a wake-up call. Let's act now, with awareness, kindness, and commitment. Your kidneys and your future self will thank you.